AstraZeneca and its partner HUTCHMED just posted a result that could change how oncologists handle one of the most common problems in EGFR-mutated lung cancer: what to do when a patient's cancer stops responding to Tagrisso. AstraZeneca and HUTCHMED announced that adding Orpathys to Tagrisso produced a statistically significant and clinically meaningful improvement in both progression-free survival and overall survival, compared with standard platinum-based chemotherapy in a Phase 3 trial called SAFFRON. Here's why this particular trial matters so much. Tagrisso, known generically as osimertinib, is AstraZeneca's flagship targeted therapy for EGFR-mutated non-small cell lung cancer, and it's already the standard first treatment for that mutation worldwide. But cancer is adaptable, and one of the most common ways EGFR-mutated lung cancer eventually gets around Tagrisso is by amplifying or overexpressing a completely different gene called MET, essentially opening up a bypass route that lets the tumor keep growing even while Tagrisso is still blocking its original EGFR driver. That's exactly where Orpathys comes in. Orpathys, known generically as savolitinib, is a selective MET inhibitor originally discovered by HUTCHMED, and it's designed to shut down that specific bypass pathway. Combine Orpathys with continued Tagrisso, and in theory you're blocking both the original EGFR driver and the new MET escape route at the same time. The SAFFRON trial put that theory to the test in a real, global, randomized Phase 3 study. AstraZeneca and HUTCHMED enrolled 338 patients with advanced or metastatic EGFR-mutated lung cancer whose tumors showed high levels of MET overexpression or amplification, and whose disease had already progressed after a first or second round of treatment with Tagrisso alone. Those patients were randomized to either Orpathys added onto Tagrisso or standard doublet platinum-based chemotherapy across 230 medical centers in 29 different countries spanning North America, Europe, South America, and Asia. The result: Tagrisso plus Orpathys significantly outperformed chemotherapy on both progression-free survival and overall survival, the two endpoints regulators and oncologists care about most. AstraZeneca and HUTCHMED are calling SAFFRON the first Phase 3 trial ever to show significant improvements in both of those measures, specifically in patients whose EGFR-mutated lung cancer has progressed on Tagrisso because of MET-driven resistance. The safety profile of the combination lined up with what's already known about Tagrisso and Orpathys individually, with no new safety signals showing up in the trial. That is the story of AstraZeneca and HUTCHMED's SAFFRON Phase 3 trial. Tagrisso plus Orpathys improves PFS and OS in MET-driven EGFR-mutated lung cancer. Add your perspective in the comments, share this story with a colleague, and subscribe for the next conference.